So the question is, what caused your baby's HIE diagnosis? And if you contact a birth injury attorney like myself, will I be able to tell you immediately the cause? Well, the short answer is in general, no. I will not be able to immediately tell you the cause of it because, quite frankly, there are a lot of things that can cause a baby to have an HIE diagnosis. And now, in our context, HIE is a reduction of blood and oxygen, which can lead to a baby suffering a brain injury. And so this can, the cause of this can be genetics. It could be a genetic issue. It can be a developmental issue, but it also can be birth trauma due to something that the doctors, the nurse, or the hospital, they failed to do during labor and delivery. And so in our context, from a medical legal standpoint, we can see the cause of HIE being, it could be a umbilical cord compression. You can have the umbilical cord getting compressed, and the readings on the electronic fetal heart monitor, they are suggesting that the baby is in fetal distress due to this umbilical cord compression. And for whatever reason, in some instances, the doctors, the nurses, they either fail to diagnose this, they either fail to see it, and when they fail to see it, they fail to treat it, or it goes on for so long and that the injury begins to occur. And so I'm, just trying to help you understand quickly in this video, when we're doing a birth injury investigation, these are some of the things that we are looking for. Did your baby have an umbilical cord that got compressed? And if it did get compressed, what did the doctors and the nurses do? Were there other issues that could have been there? Was mom dealing with tachycystole? Were there uterine problems? Were there placenta issues? All of these things have to be looked at when we are doing a birth injury investigation, because all of these things that I've mentioned and some more others, they can all contribute to your baby's blood and oxygen level either being reduced or being cut off. And like I said, if this goes on for too long, you don't necessarily have to be a medical doctor to understand if your baby is not getting enough blood and oxygen that you can have a serious injury. If you have more questions, maybe you're here watching this video today because your baby has an HIE diagnosis and you would like us to do a birth injury investigation or try to help you understand what may have caused the injury. Was it something genetic, or was it developmental, or was it due to birth trauma? Was it something that the doctors and the nurses that they failed to recognize during labor and delivery, and this is what has caused your baby to suffer a traumatic brain injury? If you have this going on, and like I said, if you want to speak with me further, there is a telephone number on the screen. I invite you to go ahead and pick up the phone and call me. It costs you absolutely nothing to call me and to talk with me about your baby's story. When you call, just let my secretaries let them know that you would like to get on our calendar for either myself or my co-counsel Renee Boston, and you would like to talk with us about your baby's story. One more thing. I practice law here in the state of Maryland, and I know this video is on the internet and I can't control who's watching it. So if you are not in Maryland and you're watching this video and you reach out to me, just understand that we have to use what we call co-counsel or local counsel. In other words, an attorney in your state. And that's something that we can work with you on, but I just want to make sure that you understand that co-counsel, that local counsel aspect of things. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. We'll talk with you next time. Take care. Enjoy the rest of your day.